Next is Christopher Hanson, followed by Jessica Spearman.
Can you all hear me? My name is Christopher Hanson. I appreciate the opportunity to speak to you all tonight. I'm a proud resident of Greenville. I live half a block away, so you could have not made this any easier for me tonight. And I'm also a partner at the law firm of Nelson Mullins, where I head up our FDA regulatory practice. Earlier this year, Governor McMaster appointed me as a board member to the Children's Trust of South Carolina. Children's Trust of South Carolina is the only statewide organization focused on the prevention of child abuse and neglect. We lead and to support a network that shares the belief that all children should thrive, live in secure families, and be surrounded by supportive communities. I'm here today to talk to you about the opportunity we have in South Carolina to expand voluntary home visiting services. Home visiting services are voluntary programs for parents, mostly mothers, of babies and young children. The programs feature a trained professional working one-on-one with parents to support, mentor, and coach them and help give their babies a strong start to life. It is called home visiting because these professionals work with families in the home. By making that house call, professionals meet the parents where they are and can get a full picture of what is happening. For example, a home visitor may see that a baby doesn't have a safe place to sleep and the family needs a crib. They may also recognize that the family could be struggling to pay their bills and could refer them to community-based services. Children's Trust has been administering the federal investment in home visiting services in South Carolina for over a decade. And data proves it to be an effective investment for moms and their babies. We know that families that participate in voluntary home visiting services have fewer emergency room visits, lower rates of child abuse and neglect, lower rates of childhood obesity, and lower rates of infant and child mortality. Additionally, mothers can get the care they need to ensure their physical and mental health is doing well. In rural communities, these programs are especially important. We know healthcare for mom may be far away, and for too many families, transportation is a concern. In South Carolina, home visiting eligibility requires being eligible for Medicaid. Currently, less than 10% of eligible families in South Carolina are receiving home visiting services. Beginning next year, South Carolina has the opportunity to expand home visiting programs by investing in a federal match program through Children's Trust of South Carolina. With a minimum state investment of $250,000 in Children's Trust for home visiting, the federal government will award up to 3 times this amount, meaning we can help more families, provide the assistance they need to ensure children get that strong start in life, and reduce the number of children who suffer abuse or neglect. We know that what happens in childhood can last a lifetime. We believe this investment will provide rewards for our future and theirs. I'll just finish my last sentence here. As a proud and dedicated resident of South Carolina, I urge the General Assembly to take up this unique opportunity to expand voluntary home visiting throughout the state by investing $250,000 in Children's Trust in 2024. Thank you again for your time tonight.
Thank you. Do we have any questions? Yes.
I appreciate you coming. We had some folks from the trust come to our meeting in Columbia, and that 1 to 3 match, drew some questions. So I had our staff look at it. So in Greenville County, for example, a $250,000 commitment from the General Assembly could draw down $750,000, and that would fully fund first-time Medicaid-eligible moms to receive a home visiting program in all of Pickens and Oconee County with just a $250,000 gift. And so if you could just kind of maybe talk a little bit about the trust is primarily a funder of services, not a service delivery. And where are those services generally provided? Are they all over the state, or are they generally in rural areas?
Sure. So we have provided all members of the committee an excellent brochure about home visiting services, and it shows that we reach the vast majority of the counties throughout the state. So while your example is just here in the upstate, it does have an impact in all members' districts for the most part. It's not in every county, but it's in the vast majority. Sarah Knox, who's our lobbyist, can follow up on specific points related to particular locations or counties. But you are absolutely correct. This is a 3-to-1 matching program, and it's up to $250,000 from the state that would be matched. Our Senator Tim Scott was one of the individuals that pushed for this matching program when it was included in legislation last year for the first time at the federal level. So given that Senator Scott, pushed for this at the federal level, we would love to see South Carolina be one of the first states in the country to put forward these funds for that 3-to-1 matching from HHS at the federal level.
Thank you. Thank you for being with us. Next is